Good morning, everyone. I'm John Delico, and today I'll be addressing how to enable successful self-management when working with people with chronic conditions, in particular, how to manage and work with people with epilepsy. Today I will be honing in upon the three key elements to successful self-management, which are 1. Identifying and understanding why self-management is important. 2. Common barriers to self-management. And 3. Working in partnership with others to create a sound, multidisciplinary team. I'll also be focusing on epilepsy as a chronic illness and how it can be integrated into these elements. Firstly, I would like to identify what a chronic condition actually is. O'Halloran used a set of criteria to define chronic conditions. They state that chronic conditions may have a duration that has lasted or is expected to last at least 6 months, have a pattern of reoccurrence or deterioration, have a poor prognosis, and produce consequences that impact on the individual's quality of life, which typically refers to burden of disease, which is a health status indicator. Now, I would like to begin by getting you to ponder on a few questions. What do you think self-management really is? Have you ever been a part of an interprofessional team as a patient or as another viable asset? For example, a family member, health practitioner, the carer perhaps? What was effective about working in a multifaceted team? Or what were the things that could have been improved to ensure a more collegial performance? As I continue through this presentation, I would like you to think back constantly and reflect on these questions and relate them to your personal situations and experiences. According to Kendall, Ehrlich, Sunderland, Munichberger, and Rushton, in their research paper, they suggest that self-management predominantly refers to education programs that theoretically equip people with chronic disease with the necessary information and skills to manage their own healthcare, maintain optimal health, and minimize the consequences of their condition. I would like to know, do you think that self-management is only limited to self-care? Or do you think that it may also encompass prevention? Well, I believe that self-management does incorporate elements of self-care as well as prevention. Agreeing with Flinder's Human Behavior and Health Research from 2009, the reasons why self-management is important are as follows. 1. Enhance knowledge of the condition and how to manage it. 2. Actively sharing in decision-making with health professionals, significant others and/or carers. 3. Monitoring and managing signs and symptoms. And 4. Having access to and confidence in the ability to use support services. Moving on, I would like you all to think about someone in your life that has a chronic condition, but preferably epilepsy for this situation. What is epilepsy exactly? According to the World Health Organization, epilepsy is a chronic disorder which is characterized by recurrent seizures, which may vary from a brief lapse of attention or muscle jerks to severe and prolonged convulsions. The seizures are caused by sudden, yet usually brief, excessive electrical discharges in a group of brain cells. How do you think we could possibly implement any of these strategies in helping to enable an individual with epilepsy to improve their well-being and achieve a better health status? For a real-life case study of how we can present these effective self-management strategies to an individual with epilepsy, I would like to introduce you to Ben. Ben is a 24-year-old young man who is rather empathetic and resilient. He has had epilepsy for around a decade. He has had many seizures over the years, and regardless of how bad they are, he is always willing to go to work and learn. With any chronic condition, but specifically in this case relating to epilepsy, it is pivotal to have a conjunction of effective self-management as well as being able to break down barriers to healthcare and having a proficient interprofessional team encompassing the patient, healthcare practitioners, family, and carers. As I progress through the presentation, I'll continue to refer back to Ben's story as a reference for breaking barriers to self-management, as well as advocating an effective multidisciplinary team. For now, our primary focus, however, will be establishing effective self-management within Ben himself. The first step in promoting effective self-management towards Ben would be to work with health professionals to establish a sound knowledge about epilepsy and an understanding of how to manage it. For example, wearing protective equipment during the day. So, for example, head equipment. So, in case he has a seizure during the day and falls, his head is protected from serious injury. Staying in compliance with his medications and taking the correct doses if he needs to take medication, because some form of epilepsy don't require medications. Seeing the doctor regularly. Having access to and confidence in the ability to use support services by informing pharmacists or doctors that he has epilepsy, so the practitioner can avoid giving him the medication that may interfere with his condition. Ben can also monitor signs and symptoms through prevention techniques, such as recognizing the triggers that cause the seizures themselves and modifying his lifestyle accordingly. For example, different factors such as heat or stress may heavily influence epilepsy. If this is the case, Ben can self-manage by adjusting his lifestyle by avoiding prolonged periods in the sun or employ relaxation techniques, such as breathing exercises, inhaling or exhaling, as well as doing light exercise such as walking. Moving on, I would like to ask you to think about the times when you needed to access medical facilities. Was it always easy as it seems to access good quality healthcare? Or were there moments where it wasn't so easy? What were the things that prevented you specifically from being able to self-manage? Was it something like not having the information on the importance of seeking medical advice when you were suffering from illness or injuries? Or was it something like not having a supportive network of friends and family to encourage you to seek help? Well, I can tell you, according to Blasco and Mill 2014, that typically barriers to enabling self-management are the same regardless of the condition that an individual has. According to Webster's dictionary, a barrier is something that impedes or separates. Common barriers to self-management consist of the perceived estimation of the level of challenge, social, personal, environmental, and economic obstacles to a specified behavior to an individual or their desired goal on that behavior. That is according to the National Cancer Institute, 2008. These may include having a lack of family support or social supportive networks, not being able to access adequate medical facilities due to either cost or due to geographical location, low levels of health literacy, and not having the confidence in the ability to use support services. To help break down these common barriers to self-management, the World Health Organization has put in place the Ottawa Charter for Health Promotion. Health promotion is the process of enabling people to increase control over, and to improve their health. The Ottawa Charter has developed 5 key action areas to enable health promotion, which are building healthy public policy, create supportive environments, strengthen community action, develop personal skills, and reorient health services. Now, relating back to Ben's scenario, how can we implement these action areas to help manage patients with epilepsy? In order to address this case, a health promotion campaign can be put in place to amend the barriers to self-management. For the purpose of this example, I'll be referring to people with epilepsy. However, the strategies employed can be used similarly for any individual in the wider society with any chronic condition. Firstly, local governments can support and fund a health promotion initiative promoting a healthy public policy. They can implement in a community leisure centre a 3-day training course that enables health professionals and peers to teach participants generic skills such as problem solving, action planning, goal setting, dealing with difficult emotions, healthy living, medication and symptom management, and communication and working in partnership with health professionals. By doing this, personal skills of all individuals who participate, particularly the individuals with epilepsy, will be developed. As this model is a health professional and peer-led course, the community action will be strengthened as extended supportive and social networks of individuals within the community will be aiming to guide people to better health. Furthermore, Reorient Health Services will be illustrated through this program as it is addressing early intervention, encouraging people to be proactive with their health rather than reactive, as well as encouraging people to take control of their own health. Finally, I would like to shift our attention to understanding why working in multifaceted partnerships is important in treating individuals with chronic disease. According to Wagner, in the year 2000, multidisciplinary care encompasses population management, protocol-based regulation of medication, self-management support, and intensive follow-up. Wagner further states that effective chronic illnesses interventions generally rely on multidisciplinary care teams. Multidisciplinary care does not merely focus on different disciplines in allied health. It is more complex than that. It focuses heavily on the patient and their family, friends, carers, and the extended community. If we think back to Ben's case study, his mum Anthea is a brilliant example of a full-time carer and family member to having an effective multidisciplinary team. She is completely loving, caring, and fulfills all the requirements of the task of being Ben's mother and carer. It is important to note also how Ben talks about having good and bad support workers in his life. Anthea goes on to further elaborate on the necessity of good support workers being able to adapt to change. Using the example of Dave already, having already planned out Ben's day, for example, and then he goes over to Ben's house, but during the night Ben's had so many seizures and he's very tired and had a restless night. Dave, according to Anthea, is able to plan accordingly and let Ben sleep in for the morning, and then possibly, if Ben's feeling up to it, continue the activities later on in the afternoon rather than in the early morning. Dave will also ask Anthea specific things that he has to do during the times when Ben has seizures to ensure that he has Ben in safe, capable hands. What I personally feel the most rewarding aspect of this is hearing Ben himself say how he feels safe with Dave when he has seizures. What I love the most about this is a carer or support network of any nature. You can see the bond that has been established between the patient and the health professional and the initial trust and care that is in their relationship. And this here is where the underlying factor of why working in partnerships is pivotal in enabling self-management. Through creating a relationship that is based upon nurture, love, and warmth, we can generate self-efficacy within the patient and truly establish that belief in themselves that they can not only manage their condition, but defeat chronic illness. Through undertaking processes such as collaborative goal setting, group meetings, patient education, case management, follow-ups, motivational interviewing, patients will be enabled to carry out normal roles and activities and will be better managed or better equipped to tackle their medical and emotional effects of the illnesses in partnerships with their healthcare providers and extended support networks. Furthermore, according to the World Health Organization, through conducting a structured-based action plan, integrating peer support and cultural awareness, we can provide a safe environment for patients to be treated. In summary, through providing a robust composition of medical specialists and supportive networks, effective chronic disease management can be enabled by optimal care being given to the patient. Through breaking down the barriers to self-management by illustrating a culturally accepting and nurturing environment and conducting devised research strategies that are based on the needs and wants of the patient, empowerment can be established and therefore the patient is more likely to develop a greater self-efficacy. Self-efficacy is important, is crucial when it comes to dealing with chronic illnesses, because if an individual does not have that ability within themselves that they can endure and go through all the pain and suffering that comes with a chronic illness, then simply the mental battle for them is too tough. Just with life in general as well. So if we don't have the confidence in our own abilities to go through life, many challenges that we face, people won't be able to overcome those obstacles that they face in life. So you can see like the correlation to why it is so pivotal with battling chronic illnesses. Finally, I would like to leave you with these thoughts. As Anthea said herself, relax and enjoy the person. The person has epilepsy. The epilepsy doesn't have the person. I find this quote so beautiful because if we all, whether as health practitioners, family members, carers, or friends of people with any illnesses, if we all together adopted this approach when treating people with any kinds of chronic conditions, we can create a collegial and nurturing society that is ideal for improving the general health and well-being of individuals. And to me, that is the most important thing when dealing with patients with any illnesses, to establish a perfect environment where they can have the best possible facilities for them to grow and access healthcare that will help them the most. Thank you so much for your time. And sorry for coughing and drinking water so much because I have a really bad cold. Thank you.